thank you guys for the invitation and having me tonight. And thank you for your advocacy and the work that you do around this issue. And we know we spend a lot of time talking about the social determinants of health. I am so excited about your organization's focus on the political determinants of health. Those political determinants are policies and practices and budgets that harm people by denying them access to quality health care, which should be a right for all of us. My assignment tonight is to talk a little bit about health policy. In the last legislative session, there was numerous bills passed through the Health Policy Committee, and many of them were decent bills, like Senate Bill 66, Revive Awareness Day, that made June 6th a awareness day to provide more education around opioids and the opioid addiction and how that's impacting. Bills like HB 159, which targeted HIV infections that would allow certain pharmacists to dispense medicines to try to prevent people from contracting HIV. What you probably don't know about me is in my professional career of 23 years as the CEO of the Mount Olive Development Corporation, I lead and manage a Hopper housing program where we house families in which some person is HIV positive. My biological dad died being HIV positive and bisexual and died alone because he could not share either one of those issues with anybody because of the stigma that goes along with it. So I have committed my life to making sure that people have quality health care and that people that are impacted by HIV never have to die alone. It's a shame on all of us for that to be happening. So those things are very, very personal to me. I am also a person that's 35 years in recovery. I have substance use disorder disease, the only disease on the books that's criminalized. If you have any other disease, you can easily go to some healthcare entity and get treated for it. But people like me with substance use disorder, we get criminalized, stowed in jail, and repetitively criminalized and never get the treatment and help for our disease. As we look at healthcare, it has shifted so drastically that you don't even have as many treatment centers available for access for people like me to get help for their disease. I was glad that Senate Bill 330 was passed, a behavior health bill to teach behavior health and around substance abuse in hospitals. Now, it was just a bill for a small pilot in Tampa and Jacksonville, but that is a start for people to understand that you have to take substance use disorder seriously as a disease that impacts the behavior and brain of people like me that make it impossible for us to control our use of substance, legal or illegal, and medication. And you can go from policies from Nixon, Reagan, Bush, across political parties and constantly see this war on drugs. And we know that a lot of these political determinants are designed to harm certain end users. When we started talking about opioid, where the end user was more affluent people, then we talk about it as a healthcare issue. When we talk about crack and cocaine, we talk about it as criminal because the end users are poor people. As we look at other bills like the dentistry bill, I was alarmed and outraged to find out that dentists can get services approved by insurance companies, perform the service, and then the insurance company not fund the complete claim. So I'm glad that we corrected that in the dentistry bill that was passed. So now they cannot switch out on performing those services. Also, Senate Bill 66 that now will make any public establishment pay $2,000 a day if they're not in compliance with human trafficking laws. And we know that when we see a 15-year-old girl checking into a hotel for a week with a 50-year-old man, we know exactly what time it is. So I wanted to give an update on several of those policies. There are several others that were in the right direction. I am again on the Health Policy Committee. So we're in Tallahassee. The Senate has had our first committee week. It was a training week. We didn't even have committee assignments during that time because we can't get structured because our governor has a dilemma and some major decisions that he has to make. And those decisions will drastically impact what goes on in the 2025 legislative session. If he appoints himself to Marco Rubio's Senate seat, then we will have the lieutenant governor operating as the governor. If he makes that move, it might be great for his political career, but he's going to totally upset the president-elect. If he does not appoint who the president-elect wants him to appoint, it's going to create problems for him. And if he does appoint that person, it's going to make him look really weak. He was also mentioned to be appointed to a position by the president-elect, but I don't know. If he does that, then he becomes a sole employee of the president-elect who could kind of fire him at any time he gets ready to. So we have some dynamics going in the Senate. We also have someone already advocating and running for Congress that's going to have to resign in March, but has already filed several demonstrous bills to create culture wars and continue to attack certain groups of people and to put more guns on the street. And for me, everything is a health policy issue. The violence, all of the things that we see has a health problem, and it's a political determinant of health that continue to hurt us and divide us. So we have to, in the Senate, I try to wait to see what bills House members are filing because they can file up to 7 bills. And they have to have a Senate co-sponsor or someone on the Senate side carrying the bill on the Senate side. We can file as many bills as we want on the Senate side, but we have to have a House sponsor carrying those bills as well. Most people don't know the nuances of how bills move through the state legislature. It's not that we can just create an idea, go to bill drafting, file a bill, and it just goes through. Another dynamic that is very interesting to me coming from a school board and learning that in the legislators, the chair of the committee can decide not to hear the bill, and the bill never makes it to the floor. So this work is a continued work, and I'm so honored and grateful to you guys for your stamina and your understanding that it's not a one-off. We have to continue to fight this fight. We have to continue to move bills forward. I asked if my colleague, Senator Smith, was going to be on because I'm very excited about the legislation for Medicare for all and the possibility of starting that conversation. I can tell you last legislative session in the Senate, we were told right out the gate that we were not going to deal with any bills about homeowners insurance and Medicaid expansion for all. So when you're told that going in, you know if you file any bills, they're never going to be heard, they're never going anywhere. And I like to try to give a clear depiction of what happens offline that you don't see as bills and legislation come forward, and people like us are constantly trying to solve problems and make things better for ourselves and the people that we love and care about. I haven't heard the conversation of where we're going with health policy. Like I say, we got a little dilemma, and I'll just be frank about it. We have DeSantis Republicans and we have Trump Republicans, and then we have Democrats and some hidden NPAs. And we know that we have a supermajority in one party. So right now they're kind of in the Senate, rattling and raving with each other. And we're just trying to see how it all works out. What I will say to you is any health policy that's going to help people, that's going to give access to all people, whether they're citizens or not. If I'm sick and I go to a hospital, it is a moral obligation that somebody care for me. It should not matter what my immigration status is. And that's why I encourage people on the bill that was passed in the 2023 legislative session that now when you go to a hospital, they ask you if you are a citizen or not. I encourage all people to not answer that question. We have to support our immigrant brothers and sisters. It's no need for the government to have that data. If you go to the hospital and you need services, a public hospital, it is our tax dollars, and people should be able to get the services that they need. So I will be a champion for healthcare bills that's going to level the playing field. I'm in a district right now where I'm dealing with a lot of senior citizens. Over the last couple of days, I've been dealing with a lot of people that were on long-term Medicare, that were getting services where they have nurses in their homes, they need oxygen, and they needed to be recertified. So they were sent information to be recertified. They missed the information. They might have left out a document, and they were kicked off. It outraged me when I began to talk to the Department of Children and Families, because we know that they handle the recertification and then Aqua handles the implementation. They said, oh, when we reach out to them, if they don't respond, we just kick them off. If they don't send in the paperwork, we just kick them off. Well, do we not understand that a lot of these people are 80 plus years old? They're not online. Some of them are in medical facilities. Some of them are dealing with dementia, other parts of Alzheimer's disease. They might not respond. The goal can't be to kick them off. I personally think if you're 80 years old and you qualify for services, you should never have to recertify again, because nothing in your financial status is going to change. So I was not happy, to the extent that I ended up on the phone with Secretary Harris, and I was willing to drive to Tallahassee to see whatever I needed to do to get these people's services restored quickly. We can't have people oxygen getting turned off, their home health care aides not coming to see them because nobody's paying them. So for the 7 people I was dealing with within a 24-hour period of time, we was able to address that. But of course, I'm still not sleeping, because I'm sure there's hundreds of other people that have not contacted my office that's calling the number and not getting a response. So it's very important that we continue to raise these issues, that we don't quit, that we be the conscious of good health policy for all the people in the state of Florida. When we don't have quality health care and people don't have access to it, they go to the emergency room. And when they go to the emergency room for minor things, we all pay more. It is certainly more advantageous to treat sick people than it is to deny them the access to care and coverage. I started out telling you that I am a person who has substance use disorder disease. The government spends $1 trillion incarcerating people like me. In any statistics you look at with incarceration, 80% of the people there are there because of a substance use disorder disease, to the extent that 1 in 9 Black children now have a mother or father in the criminal justice system because they have a disease. Now, imagine if we took half of that $1 trillion and we expanded Medicaid for all people. We were serious about facilities and treatment for people like me with substance use disorder disease. We could save a whole lot of money. And we like to talk dumb stuff about how the crime rates are getting lower. Well, it's hogwash, because when I make my first offense, you lock me up for 5 years. I can have 5 grams of crack cocaine and I'm going to get 10 to 20 years. It's 500 grams of cocaine for the same offense. So the first time you lock me up for 5 years, I'm not going to stop using because my disease has not been treated. I have not had access to adequate health care for my disease. So the next time you lock me up for 10 years. So now I've spent 30 years of my life in jail. So yeah, your crime rate is going to decline because I'm not out robbing and stealing, because I have a disease that my body is demanding a substance in order for me to function. So I like to get down to the nitty-gritty of this, and I hope my talk to you tonight helps you to feel even more motivated and encouraged. While we have to continue to do this work, we have to continue to be the voice for people that don't have a voice, that don't know how to lift up their voice. And we have to keep pushing and bringing these policies forward on the federal level as well as the state level. A lot of times the federal government will enact the law, and then in the state, we'll come around and attach all kind of horrible stuff to it that it minimizes the implementation in the state. We passed the rights for felons to have their rights restored. The voters said, we want this. The voters across policies. Then the state came back and said, okay, but they got to pay their fines first. So it's so important that we stay in this space, we continue to advocate. And finally, we have to get more serious about having people with different expertise run for office. We need to be at the table challenging these horrible laws, these political determinants that continue to hurt our people, that continue to deny people the right to health care. Don't give them, just think about a person that's worked 80 years, that sought out the American dream. They put their life and heart into hard work and building wealth for themselves. And now they're using all of that money to pay for long-term health care because they don't qualify because of the bad political determinants. They don't have access to affordable quality health care. So we have to continue to push, no matter who's in charge, no matter what the numbers are. We can never just go away and relent. We cannot surrender quality health care to the people that are in the supermajority. We have to stay relentless. We have to continue to lift our voice. And what I personally need from you is I need information from you. I need those talking points. I need the research that you've done. I got 60 days in the legislative session. I can't do all the due diligence, even with staff, because sometimes 3,000 bills are filed, and we hear about 300 of those bills. In the Senate, I'm on both fiscal policy and rules. Every bill comes through those committees. The bill is filed, but by the time, if my committee is the fourth committee on the stop, it's changed 3 or 4 times by the time it gets to that committee. So I'm spending a lot of time reading, and I don't mind. I've even got these little cute things to put over my eyes so you don't see the bags. But as much help and support as you can give your legislators, we need it. And not just people who think like we do. The information needs to go to everybody. People need to understand the harm that is done to citizens of the great state of Florida when we don't provide mechanisms for people to have access and to be able to afford quality health care. So I will stop there. I could go on and on. I can't talk bill specific because bills have not come through the chute yet where we've started dealing with the actual bills and actual legislation. But I am going to ask, because I know you guys are entrenched in this, as you're tracking bills, if you see bad bills, send an email, make a phone call. I want that information. It allows me to be more effective in my advocacy for or against. A bill may have a good part in it and then have 7 other bad parts to it. Or I may be looking from a particular lens and you looking from a different lens, and I may not see what you see. But together, we can have all eyes on that bill and making sure that we are advocating for or against legislation or political determinants that's going to continue to harm people that live in the state of Florida.